25 million people worldwide died in the influenza pandemic of 1918 to 1919, more than the total number of casualties in the First World War. This is a staggering figure, and yet it tells us almost nothing about how the so-called Spanish flu was perceived at the time. After-the-fact statistics can seriously mislead historical interpretation and add another layer of obstruction between us and the lived experience of others in the past. The higher estimate, very common in historical accounts, is the virus's average death rate applied to the total population of France in 1918. It is a reasonable estimate, since the Spanish flu was a global pandemic that affected all populations. But it did not affect them all equally. The lower estimate is based on demographic and health statistics collected at the time, so can be expected to be more accurate. It is also surprisingly low. The case of France suddenly becomes a visible paradox. Contrary to expectations, terrible war disruptions seem to have actually limited the spread of the disease. Careful statistical modeling of epidemics can thus open up an interesting site for historical inquiry. But how did the disease affect people at the time? What did they know of it? And how did this knowledge shape their everyday experience? Though the flu affected France less than some of its neighbors, the suddenness and high virulence of the disease was certainly noticed at the local level, at least according to the personal correspondence census reports. The First World War was a drawn-out battle of demographics. Many men are required to hold an extensive trenched network, and many more to constantly replace the staggering number of dead and wounded over 51 months of murderous warfare. Gathering accurate statistics on the health of troops and civilians was essential to monitor the population available for the war effort. Regional authorities were enrolled in the collection of disease statistics. All information were transmitted up to the military headquarters in Paris, where they became classified information. No national public health plan could be drawn up, for fear of alerting the enemy to the French weakness. Discussion of the epidemic in newspapers and private letters was heavily censored. Civilian and military local authorities implemented ad hoc measures to control the spread of flu, but might well have been kept unaware of the extent of the epidemic. The flu virus was not discovered until 1933. In 1918, it was but a sudden, invisible and devastating killer. Without knowing the full extent of the disease, or that it affected enemy forces just as much, there were rumors of German bacteriological sabotage. Rumors are believed and spread because on some level they are existentially true to those who hear them. What constituted the mental landscape of French people towards the end of World War I, when such rumors sprung up? Louis Pasteur and his institute were celebrated national institutions, seemingly ushering in a new age of human control over diseases. On the battlefield, the Germans were trying out new synthetic chemical weapons since 1915. By 1918, enemy gas attacks are a familiar part of the French troops' experience. Suspecting the influenza to have been German bacteriological sabotage is not that far-fetched. Taking contemporary rumors seriously can tell us more about the historical reality of an event than sound after-the-fact statistics. Even in peacetime, statistical knowledge is the preserve of the few and has little impact upon people's realities. When in awe of big numbers, historians risk misconstructing the past.
Dieu c'est pour où, ça tient du mauvais rêve. On glissera le long de la ligne de feu. Quelque part ça commence à n'être